Hey there, good evening. My name is Linda Prezioso. This is Here's to Your Good Health. And I have a special guest tonight I'm so excited about. He's Dr. Tom Robertson. He is my eye doctor. He's taken care of me for probably 10 years, 8 to 10 years. And so he has agreed to come on the show, and we're going to talk about eye care, eye health tonight. I'm so excited. Now, we are live. It's the phone call is 443-7011. No, that's not right. Well, what is it, Lee? 4011. What? 4711. All right. I've been drinking water, y'all. 443-4011. Is that right? Okay. Anyway, he'll put it up on the screen in a minute. We're live tonight. I am a nurse practitioner at Rocky Mount Family Medical Center, and I refer plenty of patients to the new Rocky Mount Eye. We'll talk about that in a minute. So anybody that has any questions about eye health, do you have cataracts, do you have glaucoma, do you have dry eyes, Dr. Robertson can address all of those. So welcome, Dr. Robertson. We're
Linda,
so glad to have you.
So happy to be here.
It's
Thanks
awesome.
so much for having me on.
So tell me about your, you just bought and changed the name to Rocky Mount Eye, is that right?
Yes, ma'am, that's correct. Rocky Mount Eye is basically an extension of the former Watson Eye that has been a cornerstone of eye care in this community since the late 80s.
That's right.
Dr. Bill Shepard, who's with the practice still, joined Dr. Watson, I think, in 1993 or 4.
Okay.
And then I came into the practice around 1997, 98, started seeing patients in early 98. Dr. Charlotte High, whose father, I think John High was his name, had one of the first optometric practices in Rocky Mount way back when, and she joined our practice in the kind of mid-2000s years.
Right.
And then we added University of North Carolina at Chapel Hill retina referral consultation expertise, Dr. Odette Houghton, around 2007. So the four of us are still there now at Rocky Mount Eye.
Right.
And we're at the same location where Watson Eye used to be at 400 Nash Medical Arts Mall.
Yes.
On the now UNC Nash Healthcare campus.
Things change, don't they?
Got to keep up with the branding.
That's right. That's right.
And our number's the same, 443-1006.
Okay.
And we're, of course, delighted to continue seeing our established patients at that familiar location, and are taking new patients every day.
So now, do people need a referral to see you, or does it depend upon insurance, or if they just feel like they need new glasses, can they call your office? How does that work?
Yes, and yes. It just depends on the specifics of their insurance. Fortunately, we're not too inundated with too much managed care, gatekeeper type insurance plans in this region. So I think for most of the plans that we see, patients can call and schedule the appointment themselves. We take referrals, of course, from primary care doctors, from nurse practitioners. We take a lot of referrals, or I take a lot of referrals from other optometrists in the community who have patients that may need eye surgery.
Right. Okay. So tell me the difference between an optometrist and an ophthalmologist. You're an ophthalmologist.
Yes, ma'am. Ophthalmologists are, first of all, medical doctors. We have to go and typically get a college degree and then go to medical school and get either an MD degree or a doctor of osteopathy or DO degree. And from there, do an internship and then residency training in ophthalmology. And many of us will then go on and do fellowship training in such areas as retina, like Dr. Houghton, who works in our practice. Dr. Watson was a cornea-trained, fellowship-trained specialist, glaucoma, pediatrics, and strabismus, that sort of thing.
Right.
Optometrists go to a special optometry school straight out of college, so they sort of skip the medical school step, and then their schooling is, I guess, sort of, having not gone through the training myself, I guess it's sort of like a combination of medical school and residency together. Historically, there have been some distinctions. Many decades ago, optometrists would see patients just for eye exams, glasses, and contacts. In the state of North Carolina in particular, it's been a bit more forward-looking with advancing optometric credentials into treating medical eye disease, so they're able to prescribe and treat conditions like glaucoma and diagnose diabetic retinopathy and that sort of thing. The primary difference nowadays is that ophthalmologists do surgery and optometrists don't in most states. Now, there are a few states in the country where there are some optometric surgical privileges, but in North Carolina, that's pretty much the distinction.
Right. So one thing that I'm always concerned about is diabetic eye exams, because I see a lot of diabetics. There's lots of diabetics in this town. So
yes, indeed.
Can Dr. Shepard do a dilated eye exam as well as you can?
Absolutely. Dr. Shepard, Dr. High, any of a host of other optometrists in town.
Okay.
And of course ophthalmologists.
Right. So all I have to say is get a diabetic eye exam, and then if they say, well, I see Dr. so-and-so, he can do that if he's an optometrist. Well, that's good to know. I didn't know that.
Absolutely. It's very important too. Diabetes, as you know, is a huge health concern in America, and we're sort of in the diabetes belt, here in the Southeast.
That's right.
Shockingly, up to half of diabetics who should go in and get their eyes screened annually elect not to do that. So that is a public health area that we really need to work on in the medical community.
Right.
And so much of diabetic eye disease, so much of the visual loss that diabetics suffer can be prevented by early detection.
Right. And I just want to get a shout out to Dr. Shepard. Our office does a diabetic support group once a month.
That's right.
And who was our speaker last night?
That's
Dr.
right.
Bill Shepard.
He sure was.
And he taught, Phyllis Wade is our lab director, and she organizes this. And she said, Linda, Dr. Shepard taught me something. Now, she's done this for years and years. She's not trained in diabetic, but, just all. And apparently, and I didn't know this either, and I don't know if you know it because you're an eye doctor, not an ear doctor, but Dr. Shepard said that you can have some kind of a neuropathy with your hearing, the same as with your seeing.
How about that?
And he's got some hearing loss.
Yeah.
So, you learn something new every day.
That's right. And Dr. Shepard has taken care of my family for years.
Yes.
He sees my wife and kids.
Yes, he's awesome. He is awesome.
But
anybody that is a diabetic out there, I encourage you, if your doctor is not sending you to a diabetic eye exam once a year, it's really, that's just standard care, isn't it?
Absolutely. And I think most insurances will cover that. Medicare, Medicaid, the Blues, most other commercial plans. It is good, basic, important health screening.
Right. It's just
And please, give us a call at 443-1006 after 8. 8 in the morning, Monday through Friday. We have people on the phones, and we'll be happy to book you a visit. Or even better, have your primary care practitioner refer you in.
Right. And I can tell you, I've been there. I've been a patient of theirs. I don't know how long I've seen you, Dr. Robertson. Probably since you've been there. I don't know.
I lose track of time anymore.
But, it is a pleasant place to go to. You walk in, sign your little name. They take all your information, ask you what you need to do. You sit here for a little bit, then somebody comes and takes you, and they start looking at eyes. I don't know all the different names of the tests that they do. But they're all pleasant, and they're all very thorough, and they're all very professional. So if your doctor has not sent you for an eye exam and you're diabetic, ask him, say, I need to go see Dr. Robertson. And then one other thing we're going to highlight in your office right now is they're having a frame show, that's eye frames, on Thursday, May 5th. That's tomorrow,
That'll be tomorrow, that's right.
And it's going to show all the different styles from Saks Fifth Avenue, Tommy Hilfiger, Chesterfield, Adensco, don't even know that name.
Yeah.
And it's from 9 to 12. You get 20% off. Anybody who knows anything about eyeglasses, frames can be expensive as much as the lenses sometimes.
Yes, they can.
So this is an awesome thing right here. So if you haven't, if you're looking for new glasses, or you've been to your optometrist or your ophthalmologist and you've got a prescription for your eye glasses, go on over there and just talk to him. Now, is it Tina that's over there?
Yes, Tina Hodge is our optical manager, and Carrie and Bridget work with her every day in the optical shop. Tina's fantastic. We many years ago we poached her from one of the other practices in town. I won't say who, but she's just a jewel. She knows her craft inside and out.
Yes.
She's a fantastic people person, and one of the things that I've always stressed to my patients who get glasses is we are all about servicing the hardware after the sale. You have a problem with your glasses, even if you didn't buy them from us, you just walk in after 8 on weekdays and come into the optical shop. You don't need an appointment. We're happy to make adjustments for you, tighten the screws, change the nose pads, whatever.
And that's important because mine need to be adjusted. I need to go over there myself. But you know, they kind of get loose sometimes, and they slip down in your nose and that kind of thing.
Absolutely.
So,
and I'm wearing progressive ad lenses, you know, and you love and you love them and you hate them, you know. But the key is you have to keep things adjusted properly. Yeah.
So you all, if you need something, call 443-1006, and Dr. Robertson's office will be happy to accommodate you for all you need. So now give us a call. We're live tonight. You know I'm always begging for people to call, so we want Dr. Robertson to see what a interactive audience we have. What is our number? I keep forgetting. 443-407.
Here it is. 407.
Lord, I don't know why I got a brain fart tonight. 407-1111. I should be able, I've done that for the last 3.5 years.
Yeah.
So tell us a little bit about yourself. Hey, do you live in Rocky Mount? Have you been here since you started at Watson Eye? Now it's Rocky Mount Eye?
I have, and I must confess that Rocky Mount is now the place in my lifetime where I've lived the longest.
Oh, that's good.
I spent a lot of time, you know, earlier in my life traveling about. You know, went through high school, college, and then I was in the military, so we were moving here and there. And since moving here in December of '97, that's where the roots are now. And we plan
that's
to,
great.
Plan to
Because
stay there, obviously.
we were talking earlier that it's really important for our, not only our town, but anybody to have small businesses. They are really the whole cog in the wheel of taking care of small businesses, and that boosts our economy. And Dr. Robertson is one of those.
Absolutely.
So we're so grateful that you're here.
Happy to be here.
So where did you go to school?
Well, I grew up in Suffolk, Virginia, which is not terribly far from here. Went to high school at Forest Glen High School, and then went on to Hampden Sydney College, which is in Southern Virginia, and from there went to the University of Virginia for medical school. I went through UVA Medical School on a U.S. Navy Health Professions Scholarship Program scholarship, so the Navy then put me to work when I got out of there.
Sure, of course.
I did my internship at the National Naval Medical Center, also colloquially known as the Bethesda Naval Hospital.
Oh, yes.
And from there, spent 2 fun-filled years on the Japanese island of Okinawa in support of the 9th Marine Division. Some people considered it a hardship duty, but I loved it. I learned to scuba dive there and have some of the best scuba diving in the world, in fact. And learned to speak enough Japanese to get my face slapped, and ate a lot of sushi. You know, so that was fun.
All you need is sushi, bathroom, and we don't want to get the face slapped, but anyway.
That's right. And then back to Bethesda again to do my ophthalmology residency, and that was from '91 to '94. And then from there, I spent a couple of years in Central Florida working with the Florida Eye Clinic, which is an outstanding multi-specialty group in the Orlando area. And then got a call that Dr. Watson was looking for a replacement for Dr. Wohl, who had been here, and he was moving his practice to Vanderbilt, Tennessee. So I was very fortunate to be able to come right into an established practice and got busy right from the beginning.
And we are fortunate to have you too. So it works both ways. That's awesome.
Just delighted to be here. Thank you.
Yep, that's great. So anybody, you know, got to give us a call, 407-1111. Anybody have a question about ophthalmology, eye disease, cataracts? Who is a patient that's seen Dr. Robertson? Call us and tell us what your experience was. I told you what mine is. It's been very pleasant. I was telling him the story. I have cataracts, and he told me years ago, well, when you get old, Linda, you're probably going to have them taken care of. And I'm like, well, old is a relative term. What does that mean? He said, when you move to the villages in Florida, you'll probably need your eyes taken care of. And so far, I've been going to him for about 10 years, and he hasn't told me that I'm ready yet. So I'm kind of wanting a couple days off work, to tell you the truth. But
Well, with modern cataract surgery, you really don't get much time off.
No, you don't, do you?
It's
we have a call. Let's
Okay.
take that call. Hey there, this is Linda and Dr. Robertson. Here's your good health. How you doing?
Good. I'm enjoying the show.
Great.
Thank you.
Can you tell me what causes cataracts?
Sure.
Sure. Cataract.
We're going to hang up so you can address that. Thank you.
Okay, so cataracts are caused by really multiple things. I would say that most cataracts are part of the aging process, just like getting wrinkles, gray hair, and arthritis. The average age of my cataract surgery patients here is probably mid to late 70s or so. But cataracts can occur at any age. Rarely you'll see children born with cataracts. They can run in families. They can be caused by various metabolic disorders. Diabetes, which we mentioned earlier, is a stimulant of cataract formation at an early age. Trauma to the eye can cause a cataract. Steroid use, typically in patients who are on high-dose steroids, with either bad rheumatoid arthritis or asthma, and they're steroid dependent, will develop cataracts from that cause.
All right. We have another call. Let's take this call. Hey there, this is Linda and Dr. Robertson. Here's your good health. What you got for us? Hello? Well, I guess they hung up. All right, it's time for our first break. Time flies when you're having fun, doesn't
Indeed
it?
it does.
So we'll be back in just a couple minutes with more of Here's to Your Good Health. Keep thinking about those eye questions. I'm glad that lady asked about the causes of cataracts, because I really didn't know. I just, my mom had them, so I figured I got them from her.
Yep.
But anyway, call us at 407-1111. We'll be back in just a couple more minutes with Dr. Robertson from Rocky Mount Eye. Hang on.